Good afternoon. My name is Dr. Sinha, and I'm here to present this policy white paper that I helped lead through the National Institute on Aging called We Don't Ask, They Don't Tell, Addressing Incontinence in Canada. The NIA received an unrestricted policy grant from Essity Canada, and my attendance at this conference was provided by the NIA. About the NIA, it was established in 2016 to provide evidence-based public policy innovation and advice to promote best practices for aging well in Canada and beyond. So for our policy white paper, we basically conducted a study whose objective was really to comprehensively summarize the issues around incontinence for older adults, raise awareness around challenges facing those living with incontinence, and analyze policy options to better address incontinence. For our methodology, we conducted an extensive literature review, and we also used key informant interviews to help inform our policy white paper. And then the final policy paper itself was peer reviewed by 13 external experts who weren't involved with writing the overall report. In terms of background and contents, we know that incontinence is a common issue in Canada and elsewhere as well. 3.8 million, or 1 in 10 Canadians, is living with urinary incontinence. We know that the incidence significantly increases for those living in our nursing homes, upwards of 70% experiencing UI and about 50% experiencing fecal incontinence, or FI. We also know that it can lead to social isolation, loneliness, depression, and other health consequences, including an increased risk of being placed in a long-term care home or a congregate living setting. And sadly, most Canadians actually believe that this is a normal consequence of aging, and that's a problem. So we know some of the common issues facing older adults living with incontinence include really a lack of awareness and education amongst members of the public. We know that while 78% reported that they're either aware or vaguely aware of the term incontinence, many people say that while they feel people should get advice and support, we know that less than half knew what those treatment options were or what could actually be done. And we know that many people living in our nursing homes feel that fecal incontinence is a normal part of aging, and many Canadians report that they don't actually have any education on available and appropriate products that they could actually use. We also know that part of this healthcare gap or education gap exists amongst our healthcare providers. We know that when we look at our primary care providers, under 50% said they understand urinary incontinence clearly, and 38% said that they don't understand it clearly. We also know that only a third felt comfortable dealing with it, and most of them, or about half, actually end up referring people to others to get their support and advice around managing this issue. And while a majority of physicians in a study in Alberta said that they feel fairly confident managing these issues, many reported not receiving any training within the last 5 years, and 33% said that they hadn't received any additional training since they were in medical school. So we also know that underreporting and stigma are significant barriers. We know that in one study, for example, from the US, it said that many people, less than half actually report, say, fecal incontinence to a healthcare provider. We also know that when people are living with urinary incontinence, for example, only about 1 in 4 seek care, and very few receive subspecialty care as well. We also know that it significantly can cause issues of embarrassment and feeling like one has childhood issues, for example. And amongst healthcare providers, many feel that there's a stigma around providing this sort of care, thinking that it's the equivalent of doing dirty work, if you will. We also know that there's significant social consequences of incontinence. We know that about 1.4 million Canadians, express feeling symptoms of loneliness due to their incontinence. And we know that those who have incontinence, urinary incontinence, are 1.8 times more likely to experience loneliness than those without. And this can certainly impact people in a number of ways, including their sexual well-being, and also finding it hard to discuss these issues with their intimate partners as well. From a care and cost outcome standpoint, skin outcomes can be significant. For example, we know that there's an increased risk, almost threefold increased risk of ending up in a long-term care home. We know that the cost can be upwards of $4 billion, according to the Canadian Continence Foundation. And we know that the impact on unpaid caregivers can be significant, from increased time providing care, from managing incontinence issues, such as doing laundry or bathing a loved one. So this all has significant care and cost consequences. When we looked at what some of the ways of managing incontinence, we know that there are some promising and proven approaches that are developing around the world, but no single jurisdiction has a comprehensive approach in place. So we know that there are various innovations that are coming about to help people better be aware of their issues and better manage through health promotion groups, for example, or other certain approaches that really focus in a person-centered way. We know that there's a growing interest in growing the ranks of continence advisors and continence specialists like nurses and other healthcare providers to support physicians in providing care. We also know that other innovative things such as technology like electronic monitoring systems or even apps, for example, that can help people find washrooms, for example, or teach them with pelvic and floor exercises. These are just some of the examples that we highlight in our paper that show that there are some promising approaches, but nothing that's being used on a widespread approach. So what are some of the policy options that we came up with to better address incontinence? We came up with 6. Number 1, we feel that we need to do better job improving efforts to raise public awareness and reduce stigma, but we also think that there's a lot of work to do to provide more education for healthcare professionals. We think that we need to be encouraging quality setting bodies to develop, to incorporate and adopt more evidence-informed practices to account for and measure incontinence. And we also need to promote more research and knowledge translation of best practices to manage and treat this issue as well. But also focusing on how do we improve the availability of publicly accessible toilets as part of the creation of age-friendly communities, and finally promoting greater equity around funding supports that can help people better individually and collectively manage issues with incontinence. So we have a number of references that we are just leaving here so people can look at that we relied on for the creation of our policy paper, and I thank you for your attention.